Good morning. Headlines for today's news bulletin are: researchers in Japan create unique system for drug delivery. US scientists make modifications in human embryo. Scientists develop device for measuring foot pressure. Surgeons use glowing tumor technology for removing hidden cancer cells. Moving on with the main news now. Researchers in Japan create unique system for drug delivery. In an attempt to produce a better drug delivery system, researchers from Kumamoto University in Japan focused on a transdermal protein delivery system. This technique increases the permeability of the skin by heating and removing the first skin layer, that is the stratum corneum. The researchers used a combination of transparent gel patches, gold nanorods and near-infrared light to create a unique thermal ablation system for transdermal drug delivery. The experiments have shown that the photothermal effect on gold nanorods by irradiation of near-infrared light causes the skin to heat up and become more permeable. This technique has yet to deliver any specific protein drugs, but the researchers are confident that it will contribute to the development of effective transdermal delivery systems. US scientists make modification in human embryo. American scientists have managed to edit and improve the DNA of human embryos in an effort to correct the gene defects that can cause inherited diseases. The DNA of human embryos has been edited previously by scientists in China, but this is thought to be the first time the controversial practice has been carried out in the US. Chinese scientists had previously reported using CRISPR to edit human embryos, but they were only successful in altering a small number of cells. Scientists at Oregon Health and Science University have shown that because the CRISPR errors are known, it is possible to avoid this problem. The team reduced mosaicism by ensuring that CRISPR was injected into eggs early on while they were in the process of being fertilized with sperm. Although none of the embryos were allowed to develop beyond a few days, this breakthrough has meant scientists are now one step closer to achieving the birth of genetically modified human beings. Scientists developed a device for measuring foot pressure. A team of researchers at Kaunas University of Technology have designed a device for measuring pressure on human feet. Its applications vary from children illnesses prevention to monitoring physical condition of professional athletes. Of all human organs, the most pressure is endured by the feet, which are carrying all the weight of a person while walking. The change of feet pressure can serve as a perfect indicator for diagnosing occurrence and development of certain health conditions, such as feet pathologies from diabetes, toe deformation, and flat feet condition. The device records the data from mobile sensors placed on an insole of a shoe. Later, it is being sent via Bluetooth connection to a computer for visualization. For this purpose, a smartphone with an appropriate app could also be used. Surgeons use glowing tumor technology for removing hidden cancer cells. Surgeons were able to identify and remove a greater number of cancerous nodules from lung cancer patients when combining intraoperative molecular imaging through the use of a contrast agent that makes tumor cells glow during surgery with preoperative positron emission tomography or PET scans. The study from the Abramson Cancer Center at the University of Pennsylvania is the first to show how effective this combination of molecular imaging with the tumor glowing agent can be when combined with traditional PET imaging. Researchers are currently evaluating this technology in a formal multi-center trial that will be the first phase 2 study of molecular imaging in the United States. They're also exploring the effectiveness of additional contrast agents, some of which they expect to be available in clinic within a few months. Thank you.